Hi, good morning, boys and girls. Today we're going to talk about lower back and hip pain. And through this four-pillar concept of movement, strength, mobility, and flexibility, what might be causing it. Today we're going to discuss some of the external rotators and internal rotators of your hip. And we're going to go over the the mobility and the flexibility section with two different exercises. So one, when we go into the mobility, kind of like the manual massage, if you're doing that and you feel really no great discomfort and the balance on both sides is fine, then go ahead and move towards a flexibility exercise. I like to open up the tissue before I go into a positional stretch, which I'll explain during the exercise. However, in the stretch, if you recognize that both legs are very similar, you're not struggling with the flexibility of the movement, then we know from this four-pillar concept that movement and flexibility might not be the cause of your root pain. And then in other videos, I'll talk about kind of the strength, this idea of needing balance on both sides, meaning we don't want Team Navy SEALs versus Team Toddlers and tug of war. That's no fun for anybody. And also movement to make sure that we're moving correctly, because if you don't use a door correctly or open a window correctly, eventually it's going to break. Your body is the same. So I want to have you start to understand where maybe your air quotes weakness is coming from, because when you understand your body better and possibly where your, again, air quotes weakness is, then we can start to address what you need to do to make sure that you fix your pain. Because while everybody in the world might have lower back pain and hip pain, it might not all be coming from the same ratio of those four categories. All right, so exercise number one can be done with this hip opener tool or also a kettlebell, or I'm gonna link a video here, an older one, where you can also do it with a ball and a chair. However, what I want you to do is I want you to take whatever you have, and I'm gonna work on my left leg because this is my problem leg. So what I wanna do is somehow find a way to sit on one of these I don't know what you would call that thing. Handles, let's just call it that, because if you use a kettlebell, that's exactly what it is. And all I'm doing is I'm going up into my high hamstring. So I'll kind of link the area here with where I want you to work. And what I'm doing is I'm trying to find a discomfort level of, let's say from 1 until 10. I would say that this would be, I don't know, 4 or 5. If this is like 9, 10, 15 out of 10, that's also okay, but you just want to understand that then that is definitely probably one of your issues, and this is the area that we want to open up, either A, through mobility, so massage with an inanimate object, or through the stretch, or a little bit of both. I always like to start with mobility first, just because I believe that kind of releases the neurological tightness of a muscle versus the actual shortening of it, right? So this is what I believe that the positional stretching, which I'm going to go into next, focuses on. But right now, I'm just kind of trying to find some trigger points or some uncomfortable areas, again, in that high level of my hamstring, and seeing if I can kind of just massage them out a little bit. I would suggest checking both legs, because the idea of this tug of war between Team Toddlers and Team Navy SEALs is always a disaster. We definitely always want everything to be in balance. Now, interestingly enough, as I'm doing this, you see now that I can sit down because something just released and it's less painful now. So again, there's no real wrong way that you can do this. You just kind of want to play with your own leg, if you will. You can move the tool in multiple positions if you want. I'm going to change mine maybe right now. So now it's more going within the direction of the muscles versus, what is it, perpendicular towards it. So now it's more horizontal. Am I saying that correctly? I got to think of my horizontal and perpendicular definitions here. But either way, I'm just kind of, actually I liked that a little bit better before when it was a bit more perpendicular. There we go. Into the muscle. And you can see, as I'm chatting with you here, I'm literally doing the exercise myself, just, oh my gosh, opening it up. And this is also great because this really also kind of gets into the groin too, which is fantastic, because the body knows where the pain is. You don't necessarily have to. You just need to work within the general area, and where it's more uncomfortable, stay there more, because that's the language your body speaks, and that's what it's trying to tell you where the focus needs to be attended to. All right, so now I am in the stretch position. I have the option to use 2 yoga blocks, but for right now, I'm not going to. So the goal is first to try to sit like this. Now, one of the things I like to do that will also help you sit is I like to turn my hands in like hooks, grab wherever. I'm gonna grab my calves. If you need to grab your hamstrings, that's also okay. And what I wanna do here is I want to use my legs, not necessarily to pull me forward, but to start to roll my legs outwards. Because remember, I spoke in the intro about how joints work on traction and rotation. So traction is going to be getting a little bit of spacing in that joint, and rotation is going to be, in this case, we're externally rotating legs. Now, what I've recognized, me personally also, my left side, due to driving and sitting too much, I guess, in my previous life here, is that my left leg was always rotated in, but my right was not. So as I wanted to externally rotate this on their own, I started getting cramps in my hip flexor, which ironically enough, when I did this stretch here, it always would cramp in my hamstring unless I took a lot of time and opened it up before. So from here, what I do is I'm not even trying to go down and forward at the moment. I am literally just rotating with my hands, with my arms, both legs out. Now from here, because I've been doing this consistently the last couple weeks, this has gotten much better. So your body will respond. I always say that your nervous system wants to work with you, but you can override that whenever you want. Therefore, if you just override what it's trying to do, it will end up listening, and that's where our chronic pain comes from. So from here, all I'm doing is just allowing both legs to turn out, feeling the balance or imbalance of them. And from now, what I want to do is I want to try to imagine I'm pushing my heels into the ground. So what that does is it allows my back then to become a little bit more straight. I'm not trying to bend down like this. I'm trying to really come up as straight as I can. A lot of times I think about like medieval torture devices, and if someone were to like pull me apart, how they would do it. And in this case, I imagine something's pulling me in this direction there. Now, I spoke about using these yoga blocks if you choose to. What I will do is it's going to block me a bit from the camera, but I will stack them just like this. So you have two options. One, head down. My favorite one is more chin up, because what that allows you to do is that allows you also to push your chin against it, so you can kind of get this contract, relaxed position, and it also just allows you to chill a little bit. I think of my pug that I used to have that would just drop her chin like this basically anywhere in my body when she was sitting, because she was too lazy to hold her head. But that's exactly what I'm doing here, and I'm still focusing on rotating my legs out, and now I can also try to push my heels, my butt, but also my chin down to really try to kind of lengthen myself in that direction. This is fantastic, because in this positional stretch, which I spoke about in the intro, this allows your body to find the problem. So instead of you being like, oh, I think I have a tight external rotator of my left hip, it doesn't matter. In this position, you're putting yourself in a position so your body will stretch, so to speak, the shortest link first. So we're always trying to find the weakest link. In this one, your body will find the shortest, and as that begins to release and open up, then your next shortest link will start to stretch. You don't really have to do anything about that, because your body will do it itself. Now, all of these kind of why and what goes on in your body concepts, I speak about in all of my online lower programs, online programs, guy, I can't talk. And also the option for a personal consultation one-to-one with me, we can also chat about this. But the why is probably the most important thing, because when you understand the why, then the how is super simple. So again, what I want you to do is just continue to rotate into this stretch, to go into the stretch. You can even move the blocks and see how it feels when you go in different directions. You can literally do anything you want. You can't do it wrong, because anything you do is gonna help you understand and learn your body even more. If you enjoyed this video, please like, subscribe, share it with everybody, comment below. Look at the links also for the online personal consultation with me or my online programs. They're helping hundreds of people. There's no reason they should not help you too. And until next week, thank you for taking the time for this video, and I will see you soon.